This video is a proprietary commentary for the therapeutic value of prescribing CPIN protocols, which includes utilizing Corex system theory and device as the primary home-based method for treating common musculoskeletal diagnosis. The aim of this video is to explore and explain the reasoning for the CPIN protocols to our clinical colleagues with this informal and lively presentation. Hi, my name is Dr. Dean, and I'm here with
Vinzel.
So today we wanted to kind of go over, we were talking about this before, like we need to tell people what the Corex system is, like why we're attracted to it, why it works for us therapeutically. And so I said, okay, let's just do one, not like a sales pitch, but let's do a video that just sort of talks about the benefit of it being different than everything else.
Yeah.
Right, so we agreed that it's like time saving,
cost effective,
definitely cost effective,
yeah,
and I would say those are our top two goals, really.
Yeah.
And besides that, it's interesting, it's fun, it's endlessly creative, right?
Yeah.
So it's not like, oh, well, we're going to do this one therapy where we're going to have you do this drill and you're going to do the same thing over and over,
yeah,
forever, right? So we said, okay. Why Corex system? Why bother? Okay? And then I said, well, before we answer that question, we need to ask a question kind of before that. And that question is, why rehab?
Yeah.
Right? So if we're going to say, well, why Corex system? We need to ask, well, why are we even thinking about a rehab program? And then maybe even before we answer that question, we have to ask another question even before that one, which is, why does the patient need intervention? Why not just let it self-resolve? Why not just let them go sort of about their own self-prescribed course of care? Just, take Tylenol, walk it off, whatever, rest, right? All those things. So, and then, before that even, like we're really going backwards before we go forwards. What's the diagnosis? So even if a patient is going to self-intervene, self-treat, they don't have a diagnosis because they're focusing on pain.
Yeah.
So we're going to take that concept, that diagnosis of pain, which is a problem, and we're going to move that into the third question, which was, why intervene? Well, because the patient has pain. Okay. So why is that a problem?
So I would say the reason why we want to address, I wouldn't really want to address pain. I would address the root cause of like whatever the faulty movement is. So that would kind of get into the realm of dealing with mechanopathology and pathomechanics. So say for instance, pathomechanics, it was a catastrophic injury that an athlete had. Now we have to address, because of that, they have the faulty movement pattern, versus mechanopathology, which deals with the faulty movement pattern causing the injury and addressing that. So
that's wow, because I never thought of it that way, honestly. So that's a great breakdown. So I'm commonly talking about faulty motor patterns or faulty movement patterns in a non-traumatic way.
Yeah.
But there's this traumatic presence also with sports. So then we say, okay, why do we intervene? Well, because the patient is in pain. Well, then what you're saying, if I understand you correctly, is we need to sort of understand these two stories. One is the pain cause is evident because there's trauma, right? They got struck by another athlete or tripped over a hurdle, right? So that's real. But then what happens when there's pain and there's no obvious cause, right? Which is the second one. You're just like not pathomechanics, but just mechanical, misunderstood or non-diagnosed mechanical issues, right? So then let's move to the second question, which was why rehab? Well, because there's pain. So you notice this pain thing
Yeah.
keeps,
Coming
right?
up.
And it's sort of the classic way that patients and athletes, their course of care, if you could even call it that, and I don't mean any disrespect, but it's not really a course of care.
Yes. Conventional.
Right.
Yeah.
So then we get to the first question, which is why Corex system? And that's where we get to drop the pain.
Yep.
Because
we're
it's not about
treating
pain.
pain. Yeah.
That's right.
Yeah.
So the Corex system isn't designed specifically to treat pain, but in the movement patterns, I've seen this over and over, in the movement patterns, because they get corrected, and they
Yeah.
get corrected in that
Whole
universal
shape. Yeah.
whole body, right? We call that the whole body approach or the whole athlete approach.
Yeah.
I just thought of an idea, wholeathleteapproach.com.
That's literally,
Right?
That's literally how we're treating.
Yeah.
We're treating the whole body versus, so it's treating the cause and not just the symptom. Yeah.
Right, so that sort of symptom concept is what's driving a lot of, I'm just going to call it, we could say physical type therapies. I don't want to say physical therapy.
Yeah.
Because physiotherapy is mixed in with the athletic training is mixed in there also, right? And there are even some MDs that have sports medicine specific practices, so you could include them. You could include sports chiropractic, right? It's a big overarching,
field,
right? So and so when I start to talk about physical therapy, I start to sort of bring out sort of what's called the giant in me, which is like a metaphor for you saying always and never. That's the metaphor of the giant. So I say physical therapy is always boring and it never works. So I have to be careful about that because that's not true. But I have a bias that physical therapy classically addresses only pain. So you get to the therapy office and they put on an ice pack, right? Which you could do at home. And then, they have you maybe, sit on the table, and, they could be attentive or not attentive, right? And it'd be like, okay, so there's a knee problem and your doctor has prescribed a knee physical therapy. And then, so that's where Corex system becomes the most amazing thing ever. Because
with that, now we're treating the whole open chain. So I feel like that's where Corex excels the best, is treating the whole body, especially addressing a movement that might occur at the hip or knee, but now we have to do with nerve innervation, which travels through our spinal cord. So that's something else that we have to be attentive to, because dealing with the redundancy of the sciatic nerve. So understanding that's another area that I feel like Corex, without too much getting all into the science, that's something that it helps with as well.
So it's more of a universal approach.
Exactly.
And the knee just happens to be part of that treatment plan. So the Corex system treatment plans, although they might focus on knee function, right? It doesn't address specifically the pain, right? So that can be addressed in a different way. But physical therapy doesn't typically address anything other than the diagnosed
area.
Right? Because insurance isn't paying for it.
Yep.
Right? So so they're not going to say, oh, well, we need to get up into the hip and we need to get down into the ankle mortise joint. And oh, by the way, there are two knees. So if this one's cranky, I can guarantee you there's sort of a co-crankiness going on over here, or even the ankle mortise or the hip, right? So that's that whole horseshoe that we talk about in Corex system. So what we're talking about is a physical type rationale for treatment. And Corex system addresses the physicality of performance by addressing the whole person in each drill. So for example, in the knee series, there are several different, there's the intro, the basic, and advanced, right? Let's say in the basic, right? So yes, the knee is doing different things in the drills, but it's attached to the rest of the body. Yeah. And there's really, honestly, nothing else out there as far as a movement-based therapy that joins the diagnosed area with the rest of the body. Now, here's something even more amazing about Quark System is, even if you're a clinician or a doctor, physio, whatever your degree is, that you have a license to diagnose, you don't even have to specifically you don't need to know that it's ACL. You don't need to know it's LCL. You don't even need to know, right? Is it genu varus, genu valgus? Like, what's the problem, right? You don't even need to know, because diagnosis isn't always necessary, because the faulty motor pattern may be so buried and complex in there.
Yeah.
It doesn't matter. But if you're adding movements to the body that are very universal and rely on knee orientation, and proper knee orientation becomes part of that drill, you're already like treating it by default. Like that faulty motor pattern is like in the background, and we may not even know what it is. So what Quark System does is it allows people who are just athletic trainers or strength and conditioning coaches to implement Quark System without a license to diagnose, because diagnosis isn't always that important, as long as the general area of dysfunction is understood.
Yeah.
Right?
Yeah.
But you can only go to physical therapy through a doctor, unless you want to risk it with some YouTube stuff. Right?
Yeah.
So the fact that it's only available through a doctor is a limitation for people who don't have insurance, don't have access to insurance. Their insurance only allows
covers so many hours.
And here's the worst part, Venzel. Like, and so this just happened to me today. Like, I'm personally trying to get into PT, and they said 3 months.
Yeah.
So Quark System doesn't have that limitation. It can begin today, because the programs are all online access.
Yep.
And they're free, right? So that barrier is gone, and you don't have to go to the PT office. You don't have to get a babysitter. You don't have to pay for parking. You don't have to wait. Like all of that, right? So that's like why Quark System. That's a big why. Does the patient feels better? Yes, they get better quicker, and like you said, at low cost.
Yeah.
But now there's this amazing accessibility. So we want to make something clear, because I get asked this. So I'm just going to go grab the band here. So this is the device, and it's worn across the thighs and then across the. I'm just going to go ahead and put it on. Okay, so why don't you tell them a little bit about the setup while I put it on?
Okay, so basically with the leg straps, you want to make sure that the inner triangle are facing each other, and then from there, you want to make sure it's a tight grip. For the hands, it has to articulate the ball. So to be able to do that, you cross them, and then at the wrist, you can wrap, not too tight. They can be a little loose on you. And yeah, that's basically the setup. It's fast and easy.
Take off my watch. So one thing that Venzel mentioned is that there's sort of this, which is, the part of the X, is that this leg is attached functionally to the opposite side of the body. So the lower body on this side is attached to the upper body on this side, and that's a just super functional sling, right?
Yeah.
Okay, so that's that core neutral position here.
And then addressing one thing for the mini charged band, you want to make sure it's under the red. So Dr. Dean's band is slightly off.
Oh,
for
right.
this
So
one.
this side should be
Yeah,
switched.
so it should be right under
Yeah.
the red.
So the question that I get is how much resistance do they supply? So the bands are resistant. They're not resistant. They're not exercise bands. They're not designed to be difficult, hard to pull. It's not like, is it giving you, 10 pounds, 15? You know how
Yeah.
rubber bands
Yep.
are, right?
Yeah, the
You
mini
put-
bands and the
so-
super bands, yeah.
Yeah, so the bands are not resistance bands, and they don't make you stronger, right? They're not designed to elicit a strength
Yeah.
component. What they're designed to do is cue the core.
Yep.
So simply by, what I call this charging the bands, just by gently lifting the bands just a little bit and dropping my shoulder blades back, I'm connecting my shoulder complex closer to the core area of the body, right? And in this position of 120 degrees at the knee, hip, and elbows, I'm at my
Athletic readiness.
athletic ready, right? So the bands aren't designed to be like, oh, it's really hard to pull. I'm really like using my shoulder muscles. I can feel it, right? That's not the point at all.
Yeah.
And so what we can say is if therapy includes weights, right, is that really sound mechanics,
Yeah.
right? Because what we're talking about when we talk about faulty motor pattern is a fault in the wiring. And wiring doesn't need much in order to be corrected,
Exactly.
right? So we had this crazy example because we're always fooling around, right? And so we were talking about different ways the brain listens to the body,
Yeah.
and I handed you a tack.
Yeah.
Right? I didn't tell him it was a tack, but what I did was just open up your hand, right?
Tack.
Put it in here. What is that? I don't know, right? And then I had him pinch it with his fingers like this with his eyes closed, and I said, what is that?
Instantly recognized it was a tack.
Right, and then I said, when's the last time you held a tack, right?
I can't even remember. Yeah.
That's the power of memory in neurology. So when people are like, oh, I don't know how to do that, well, you kind of do. You know what you need?
To be
Correct
cued.
system.
Yeah.
Because this is going to dig back into the archive of the patient's knowledge of movement,
Yeah.
right? At one point, we all knew how to do something right. We knew how to identify a movement, right, that works. And because I teach tennis, I see this in tennis. And they say, wow, that was really easy to do that. And I say, you know why it's easy? Because it's functional.
Yep.
Right? So correct system, I would say, one of the greatest things that it does is that it brings up from movement memory, and it puts it all together at once, A to Z.
Yeah.
Every muscle, every joint being activated all at the same time, even though it's just a knee complaint.
Yeah.
Right? And like I said, it kind of doesn't matter what the exact pathology is as long as it's not traumatic, right? It's all going to get included.
Yeah.
So hopefully that helps you understand a little bit more about the rationale or like the why of correct system. And, it's sort of a springboard to a larger conversation. I think we're going to do a part 2 to
Yeah,
this.
definitely. We definitely have to.
Yeah, and then we'll talk about the 5 principles. And then, of course, you don't have to remember all this because we have a certification program that's going to be opening soon, which is 7.5 hours of online education with just all of our great stuff. If you really wanted to get to know the bones of the correct system. So thank you very much, Dr. Dean.
Denzel.
Thank you for joining us. Look forward for part B.
Bye, guys.